Thank you, Mira. Gosh, I'm working hard this morning. And I'm delighted that they put the microphone down so that we don't have to go up here like earlier with Andrew. So I'm going to speak today about what's happening in the global policy landscape, and I'm delighted to be joined by some amazing speakers that will delve further into this particular issue and also in the national issue, because that's very important. Just this week, we have had some very positive news about Mexico, hopefully cross finger from Brazil. So things are moving. We are in a really hopeful moment. So it's a great pleasure and an honor to be able to speak at this plenary, which is really a plenary about where our world is going, about what is happening, about the promises made by governments, how those promises are translating for those that really feel them on the ground, the people who are living with dementia globally, their families, their communities. I've struggled to write my intervention this time, despite usually not being a person that is at a loss for words, as many of you will testify. But this time is different. We are truly in the middle of a maelstrom with Alzheimer's and dementia, and we are being bombarded from many directions. There is a lot of hopes and a lot of promises, but so many that it is hard to see clearly in the middle of the storm. In addition, this year is our 40th anniversary, and it is right and appropriate to dwell on our growth and achievements in the last 40 years of our life. We are lucky today to have Her Majesty Queen Sofia, Her Royal Highness Princess Mona, the Vice Minister of Health of Poland, and many ambassadors and more ministers that are following us at home. This is a bit of an extraordinary thing and a great achievement for all of us in our 40th year. So this time I will do a bit of both. I will first focus on our current situation, and then I will delve on our 40 years of being strong and resilient together. And this is, of course, our anniversary logo, which I think all of you have seen and enjoyed on your bags. ADI has always been at the forefront of what is happening globally, and we always try to bring you the latest in our field, forecasting, if possible, the issues well ahead of time. As a recent example, I would like to highlight that when we published the World Alzheimer's Report in 2021 on diagnosis, it was because we knew that with disease-modifying therapies on the horizon, we could have people suspecting they may have Alzheimer's or dementia demanding treatments. But since those treatments require a confirmatory diagnosis, and since the diagnostic capacity globally is still way below what is needed, as we show in this publication over and over again, healthcare system would be in trouble unless action was taken pretty quickly. If you read my introductions to the latest few World Alzheimer's reports, you will see described in a nutshell many of the issues unfolding now at national level. It is the advantage of having a truly global view of what is happening, a global perspective that ADI has thanks to our visibility of high-level issues at multilateral level, as well as of national ones, thanks to our members, many of you here today with us, who keep us abreast of our developments in the countries as they happen. And so, I thought of sharing with you in this session what are the high-level issues that are floating in my mind right now. Each of them has the potential to become huge and will need tackling in its own right. I would like to dwell on this slide a while and share with you its many bullets, explaining what I fear we could all be working on in the next few years. I will go through them one by one, but I will not put this slide up again. So maybe you could take a picture of it now, as we will be here for 3 days, and we will not probably have time for Q&A, I will welcome your questions and challenges to my thinking throughout the conference. Now, let's focus on policy first. We should not forget that most of the world is still in a post-COVID-generated recession, and there are some major wars happening as we speak. We can't ignore that. This is happening. There is still not a lot of money going about, and the competition for those funds in healthcare is relentless. Governments all over the world are in flux. This year alone, there will be 55 national elections. Government changes are hugely difficult for civil society. A new government can be good news, but also not honor commitments of the previous one, as we've seen happening ever and ever again. A growing and aging population globally is another big topic on the horizon. The world is getting older, and the needs of our populations will change very soon. The UN Conference for Population Growth, where I spoke last autumn, was enlightening, and it was great to see some governments engaging with this issue. But as the vision for governments is increasingly limited to the 5 years electoral cycle, it is hard for me to see how we will find the energy globally to elevate this topic. The graph to the left shows you in gray the world population in the 1950s, in blue in 2010, in light blue in 2050, and in red in 2100. It is not hard to work out that we are moving to a position where there won't be enough people in the world to care for all those who need it. Hence why we have now decided to work also more proactively with the Department of Aging at WHO. They're here with us today, and engage more in the decade of healthy aging. This leads me to the cost of care, which continues to be a barrier when discussing dementia with governments. Many still think it's not their problem, or that families can pick up the slack, which we know they can, but up to a point. And that reasoning does not work in any case, as increasingly more and more people live alone across the globe, not just in high-income countries, but everywhere. So who will help them? The above goes hand in hand with the lack of interest in older citizens, which are often still not a priority of governments, in my experience. Indeed, governments continue not to see the link between providing more free and respite care for their citizens with having a happier and more productive workforce. Moving on to another topic, on the hub and spoke slide that you hopefully took a picture of earlier, with regard to awareness raising, the dementia friendliness and inclusivity movement has lost a bit of momentum. Perhaps it is time for all of us to revisit it. We are waiting to see the results of our survey on stigma this year that will form the basis of our World Alzheimer's Month and World Alzheimer's Report. If you've not filled the survey or shared it yet with your friends, do so please this week. It will help us shape our calls on lowering the stigma globally. If you think back to the hub and spoke slide I showed earlier, I would call the risk reduction area the hardest easy win ever. If we can prevent 40% of all dementias by adopting lifestyle changes, why is it so hard to get this message across to governments and translate it into public health campaigns? Vis-à-vis the diagnosis and post-diagnostic support, we just had the plenary on this morning, as well as the issue of lack of diagnostic capacity and the lack of awareness of the critical need for post-diagnostic support, I would add that the biomarkers may well be here into the scientist's mind, but alas, they are certainly not there in the hands of primary healthcare practitioners working in communities all over the world yet. And the education of those practitioners is urgent. Let's not forget that in the World Alzheimer's Report 2021, 62% of them say they are not likely to diagnose dementia as they feel it's normal aging. Some of our members' organizations, for example, the Alzheimer's Association and Alzheimer's Society, who are running symposia at this conference, are really working very hard in this direction. And it will be fascinating to see how much traction will they manage to achieve with their governments over the next few years. But let's now tackle the big topic of diagnosis and support. One really exciting new field of development is that of AI-assisted diagnostics. That could be really a game changer and address the lack of trained professionals, although, unless I am mistaken, it won't address the lack of PET scanners all over the world. The slide above tells you how they're growing in Europe, but they're still not enough. The field of disease-modifying therapies is currently very alive with excitement, and we want it to be this way. so that much more needed funds for this area will pour into our sector. But it would be naive to think that those meds are for everyone. Indeed, they are for a small percentage of the population so far, and that percentage needs a confirmatory diagnosis, which, as we said in the World Alzheimer's Report 2021, is not available to over 70% of people globally. In addition, there have been noticeable splits in the scientific community on efficacy and safety, and there is definitely confusion in patients who can see from the press a solution in reach, only to be told by their doctors that it isn't really there, or for them. And regulatory approval, oh, sorry, I didn't show you this slide, so if you want to take a picture, that's the one about the diagnosis issue. And regulatory approvals in some part of the world and not others means creating a world of have and of have-nots, where the rich can fly to areas where the treatment is available to them and the poor can't. There is also the issue of whether our community is being discriminated against. The cost of these meds can be very high, that's for sure, but why should cancer patients have risky infusions available to them, but not our community? We have written to the CMS and now the EMA along these lines, and it will be interesting to see how this plays out, although I'm told these kind of issues have been common when medication in areas previously untreatable get launched. In the care sectors, there have been giant strides in research. It is really heartening to see the difference that good care can make, and many of you here today will be telling us more in the course of this conference. Here is a picture of a recent visit to a great care home in England. But there are still big issues that require addressing. Migration of healthcare workers, for example, is becoming a big topic, in particular after COVID. There are huge human costs around it too. It was heartbreaking to hear of the suicide rates of migrant care professionals from Nepal, for example, at a recent WHO and NHS webinar. The growing cost of care, the scarcity of professionals available, the fact that more people are living alone, and the increasing need and lesser availability of respite care are the issues ever present in my mind. Another topic of great interest in this area is rehabilitation, which deserves more space and more talking about. Rehabilitation is particularly poignant in lower and middle income countries. It's cheaper to implement and it works. So why not do that more also in high income countries? Watch this space as we may be working on this issue more very, very soon. And at the local level, wonderful things are happening. At a recent visit to the Italian region of Veneto, I was surrounded by happy families that were really benefiting from what the Italian government has made available to them through the skilled work of the healthcare professionals in Mestre Hospital. It is rare for me to visit regional level initiatives, and it did me a lot of good to witness firsthand how the work that we do, which sometimes can seem a little bit too high level, to us at least, actually really benefits people in communities around the world. We are indeed here to change the world for better, a little step at a time, aren't we? And in research, there have been advances, but it's still a tiny sector in comparison to other non-communicable diseases. With this quote from Bart de Strooper last year, as you can see, it says, earlier this year, de Strooper searched the US medical database PubMed for dementia. He found 250,000 studies. He then searched for cancer and found 4.7 million. Next, he searched for COVID, a disease that didn't exist before 2019, and found 300,000 studies. It's a rough metric. But what this means is suggests that more research has been done on COVID in the past 3 years than on dementia in the past century. I leave you to mull over that. And LMICs are still marginalized when it comes to clinical trials, as you can see from these slides. From my standpoint, lots of research funding is still going to small, non-scalable projects, or sometimes projects focused on one nation or group of nations only. I know this is a necessity. Nation states want to see their research money going to researchers in their own country, understandable. But it would be so great to see more cross-border collaboration in visionary activities like the finger study. Artificial intelligence is a promising new area in research, and you will hear much more about it in this conference. It could be seriously exciting, but at the other end of it, there is also AI-generated misinformation, which could quickly become a problem, where information-starved people living with dementia and families need help, as well as issues relating to financial fraud, where AI can also become a challenge, and there will be a session about this at this conference too. Overall, in my mind, the biggest problem in research is still translation. We at ADI try our best, but in an ideal world, I would like the academic community to make what it does more understandable to the general public, to think of dissemination and impact of what they do as a major part of their projects and not a side event, and to really incorporate people living with dementia and families in the design of their project as an integral part and not just a tick-box exercise. And this latter point is relevant also of innovation. We see many companies being born in our space, but few think about involving people living with dementia in the design of their products or research. In a nutshell, we are seeing more and more fantastic examples of good research, but we are still a way off from an ideal scenario. Finally, in the world of data collecting and sharing, a lot has changed, and the WHO Global Dementia Observatory is now bearing fruit and really useful to find information on implementation of the Global Action Plan, at least from a governmental perspective. From the perspective of families and people living with dementia, our From Plan to Impact report is still the best source of information. The next edition will be launched in Geneva on the 29th of May, and we hope you will log in and follow the event next month. Private initiatives like ADI are also giving a great example, as we heard at our conference in 2022. I'm rushing because my time is running out. But on data, there is a final and most pressing issue to address. Dementia is now finally being recorded in more and more countries as a main cause of death. Amazingly, in many countries, it didn't used to be. This follows a number of calls for this to happen, including one by the OECD in 2017. As a consequence, we are now realizing that dementia is increasingly becoming the #1 cause of mortality in more and more countries in the world, as you can see in the slide above. This, however, is still not reflected in the way dementia is perceived as a major non-communicable disease. And this matters because many of our members who try to access NCD funding in their countries are still turned down and told dementia is not a major non-communicable disease, or even that is not a non-communicable disease, full stop. We will be working very hard in the next few years to address this one. I'm taking a breath here, and I've got to rush, so I could talk for a long time, but we need to think about these things. And now I'm going to move to something a little bit happier. So I'm going to show you some of the great things that we have done in the last 40 years. 40 years of wonderful conference together, 40 years of Alzheimer's universities, 40 years of awareness raising through World Alzheimer's Month, going from strength to strength, 40 years of groundbreaking reports, 40 years of being friends, advocates, loving and caring people, 40 years of many successes. But in one area, we still have to accomplish our mission. ADI has advocated to have a global dementia action plan at WHO level for more than a decade. Once the plan was approved in 2017, we have worked very hard with the WHO for it to become a national reality. However, for our 40 years of existence, we only have 48 national dementia plans to show for. This is why we will be putting a lot of our energy and effort in the next year to advocate for an extension of the plan. Indeed, we start calling for an extension as early as last year when we launched Plan to Impact 6. And we thank the many governments globally, some will speak today, that have taken this call to heart. I invite you all to join us in our advocacy for the Global Dementia Action Plan to be renewed now. Many people have asked me how I envisage ADI will look after another 40 years, and I say to them, I hope ADI won't exist in 40 years. When I say this, many people, like yourself today, share a mixture of shock and bewilderment. But the truth is, however, that we are all working towards a world free of stigma, free of discrimination for those living with dementia, towards a world where there are effective and available treatments for all people living with dementia globally, a world where ADI is not needed. Whether this take 20, 40 or 100 years, we will not rest until this becomes a reality for all. Thank you.